Welcome to our today's presentation. And for our today's presentation, we want to have a look at dysphagia. Now, by definition, dysphagia means difficulty in swallowing. So that is the simple definition of dysphagia. Dysphagia can range from mild to even severe dysphagia. Now, there are several symptoms of dysphagia, and they include 1, regurgitation or even vomiting of food after feeding or even during feeding. The next symptom is coughing during eating or during feeding. The next symptom of dysphagia can be choking during feeding. The last but not least symptom of dysphagia can be pain during swallowing, what is referred to as odynophagia. Now, there are several causes of dysphagia that have been identified, and we are going to have a look at just but a few most common causes. Now, the first category of the causes falls under the neurological causes. And under neurological causes, we have 1, cerebral palsy. Number 2, we can have stroke. 3, we can have dementia. Number 4, we can have multiple sclerosis. We can also have Parkinson's disease. And finally, we can have myasthenia gravis. Now, the next category falls under infections. And under infections, it can take either of the following forms. And that is, we can have bacterial infections, we can have viral infections, we can have parasitic infestations, and we can also have what is referred to as fungal infections, as seen in esophageal candidiasis, among others. Now, the next cause of dysphagia or difficulty in swallowing is tumors, and this can be tumors within the esophagus itself or those tumors of the adjacent structures. For example, we can have the cancer of the esophagus, or we can also have even cancer of the thyroid. We can even have the lymphomas of the neck. The next cause of difficulty in swallowing or dysphagia is what we call the pharyngeal pouch, and this is more of like a diverticulum, though it's a very rare condition, but it does occur. The next cause of dysphagia is chronic obstructive pulmonary disease, what is commonly referred to as COPD. The next cause of dysphagia is stricture due to esophagitis, and this is more of inflammation of the esophagus that can either occur as a result of either trauma or irritation, continuous irritation. The next cause of dysphagia is called the esophageal webs or rings, and these are also notable or identified some of the conditions that can cause dysphagia. The next cause of dysphagia is what we call achalasia of cardia, and this is a destruction of the cardiac sphincter, the nerves that supply the cardiac sphincter, and therefore interfering with the relaxation of the cardiac sphincter. Now, ladies and gentlemen, dysphagia may point out to a very serious medical illness, and therefore, should you as an individual experience dysphagia or come across any client suffering dysphagia, kindly make quick medical referral to nearby health facility for quick intervention. If you're watching us for the very first time, kindly subscribe, and until next time, it's goodbye from all of us.